Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks.
This is episode 135. We can't afford not to implement Medicare for all. When some people discuss healthcare, they argue that healthcare is a human right and speak of the moral and ethical necessity for ensuring that every person can get quality healthcare without having to worry about costs. This leads many of them to push for a single-payer Medicare for all system because they believe it is the best way to achieve that goal. I strongly agree with that sentiment. However, the economic benefits of Medicare for all are compelling, and those benefits alone make the case for Medicare for all. Let's start with the basic question. Can we afford our current healthcare system? No, we can't. People can't afford healthcare. In March of 2019, I published 2 episodes on the economics of healthcare. Even back then, my guest, Professor Gerald Friedman, said that people are cutting back on food, going out to eat less, and buying smaller houses because of the high cost of healthcare. It's gotten much worse since 2019. Our healthcare system also hurts businesses. The average premium for a family with employer coverage is $27,000, and about $7,000 is paid by the employee. Healthcare costs have held down wages, small businesses can't compete, and high healthcare costs prevent people from starting their own businesses. People stay in jobs and delay retirement for healthcare coverage. We are spending more and more for less and less. That is not sustainable. A KFF poll from January of this year found that paying for healthcare is the top economic concern. About 2/3 of the public worry about being able to afford healthcare for themselves and their families. And it's going to get even worse. New requirements for Medicaid and ending Affordable Care Act subsidies are going to cause millions to lose insurance and put more financial stress on them. If we keep our current healthcare system, healthcare will become even less affordable than it is now. The U.S. spent $5.3 trillion on healthcare in 2024. Our 17.2% of the nation's gross domestic product, our GDP. Our peer countries spend anywhere from about 7% to 12.2% of their GDP on healthcare. If the U.S. spent only 12.2% on healthcare, something that is achievable with Medicare for all, we would only be spending about $3.6 trillion annually on healthcare, which results in a savings of $1.7 trillion a year. The usual figure cited for government spending on healthcare is a bit over 40%, which accounts for programs such as Medicare and Medicaid. That figure is too low. When you account for government employees' health insurance, the government pays for about 2/3 of healthcare costs. That also amounts to $3.6 trillion. So if we spent only 12.2% of our GDP on healthcare, we could cover everyone without an increase in public spending. We would save $17 trillion over 10 years. That's money that can be invested in education, infrastructure, and people. We have a choice. We can keep our current healthcare system and watch as it financially ruins people and devastates the economy, or we can choose Medicare for all. We keep asking the wrong question. The question is not, can we afford Medicare for all? We can. The important question is, can we afford not to implement Medicare for all? The answer is an emphatic no. Thank you for listening.
You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.